Good morning, ladies and gentlemen. My name is Israel Mungan, and today I will present to you on normal saline. So, there are many types of drugs used in the radiology department. These drugs of different types, which is some are contrast media like barium, some are resuscitation drugs like adrenaline and normal saline. These drugs are used to help obtain a better image quality while keeping the patient safe, among other reasons. So I'll move on to normal saline is a resuscitation drug used in radiology both for imaging and treatment purposes. It is used in the management and treatment of dehydration, metabolic alkalosis in the presence of fluid loss and mild sodium depletion. 0.9% sodium chloride is the clinical name for normal saline. So 0.9% sodium chloride is the physiological or clinical name for normal saline, and it is an isotonic solution relative to the human blood, or it is isotonic, which means it has the same solute concentration relative to that of the blood. So the movement of fluids to and from the cells is equal, so the cell does not change in shape. So that's the diagram of the normal saline, 0.9% sodium chloride. So we're now moving to the mechanism of action of the drug. So it is a crystalloid fluid, which is an aqueous solution of electrolytes and other hydrophilic molecules. Normal saline contains electrolytes like sodium ions and chloride ions, which dissociate in solution. Sodium ions are the main electrolytes of extracellular fluid, integral in the distribution of fluids and other electrolytes. And then chloride ions are important, which ions serves as a buffering agent within the lungs and tissues. So a buffer, it's a solution which tries to which slightly changes its pH. Then it helps to facilitate the binding between oxygen and carbon dioxide to hemoglobin. These ions are primarily under the regulation of the kidneys, which control homeostasis by absorption or excretion within the tubules. Then we move on to the routes of administration. So normal saline is administered through intravenous injection, IV, subcutaneous injection, intramuscular injection, and even orally, among other methods. Then when you say intravenous, you are administering a drug directly into the vein, either through a cannula, or you can use a syringe, the needle, so on. And then subcutaneous is an injection which is administered beneath the skin, in the subcutaneous layer of the skin. The normal saline fluid is usually administered via an intravenous solution which delivers the fluid directly into the vein. The fluid is usually given using a cannula. Then here is a simple diagram of a cannula using the vein here. Then pharmacology of the drug. So pharmacology is the study of the effects of drugs on living organisms. It involves the study of how drugs interact with the biological systems, including their absorption, distribution, metabolism, and excretion. So even though normal saline is said to be a drug which has no side effects, but it has some effects. So normal saline has some side effects the body when used. It contributes to iatrogenic fluid overload, especially in patients with impaired kidney function. Then when you say iatrogenic, mean it is a harmful complication or other effect which is caused by a medical activity or diagnosis. So we are saying it contributes to iatrogenic fluid overload, especially in patients with impaired kidney function. So patients with congestive heart failure are at risk for detrimental effects. And then detrimental effects are negative response of the body to the drug. Then other effects include febrile response, infection at the site of injection. Let's say at your vein where the cannula is inserted, there can be infection. There is venous thrombosis and hypovolemia. So some effects include nausea, vomiting, headache, dizziness, or a metallic taste in the mouth. So contraindications for the use of normal saline are evaluated clinically from patient to patient depending on their condition. So the use of normal saline differs from patient to patient depending on their condition. Some they have heart failure problems, some have kidney impaired problems, and some are normal. So it just depends on the clinical condition of patient. Then we are now moving on to the use of the drug in radiology. Saline is used in both CT and MRI. Its purpose is to push the otherwise unused contrast agent in the peripheral cells and the connecting tubing. It also utilizes the contrast media remaining in the vessels from the subclavian vein to the superior vena cava. Then in radiology, normal saline is also used to hydrate patients before and after an imaging procedure to ensure that they are well hydrated for the procedure. Normal saline is also used to cleanse the skin before a radiology procedure, e.g. an ultrasound, to ensure that the area is free from any contaminants or disturbances that could interfere with the imaging process. Then thank you for listening. That's my references.